Today we are going to talk about the United States healthcare policy. Did you know that it is the envy of the entire world?
Really? You mean our healthcare policy is the best?
Yes, really. So where shall we begin?
Well, how about we start by explaining what our healthcare policy is?
Sounds good to me. Why don't you take a shot?
Okay, well, today, at the moment our healthcare policy is a very controversial topic. At the moment we are in a healthcare reform.
That's right. Health reform makes healthcare more affordable, holds insurers more accountable, expands coverage to all Americans, and makes our health system sustainable.
Right now the Affordable Care Act, passed by Congress and signed into law by the President in March 2010, gives you better health security by putting in place comprehensive health insurance reforms that hold insurance companies accountable, lower health care costs, guarantee more choice, and enhance the quality of care for all Americans.
How does it work?
Well, the act will not be enforced all at once. Portions of the law have already taken effect, like provisions that implement a new patient's Bill of Rights that put an end to some of the worst insurance company practices.
To help lower costs, the Affordable Care Act sets up a new competitive private health insurance market through state exchange, giving millions of Americans access to affordable coverage. It holds insurance companies by keeping premiums down.
It affects everyone, not just you. Everyone is affected differently.
According to President Obama, reform will not affect how someone who is insurance accesses healthcare now.
And those who don't have insurance will not be charged a lot.
Well, now that we have that covered, why don't we move on to better things, shall we?
We shall. So why is healthcare so controversial, Mr. B?
Well, Mrs. S, I believe healthcare is so controversial because the people who already have healthcare are afraid they will lose their healthcare. Plus, no one wants to fund other people's healthcare more than we already have to.
That is very interesting, so tell me, how is the healthcare dollar spent?
Well, let me show you as shown in this graph. Hospital care and physician/clinical services combined account for half of the nation's expenditures. That's 51%.
What else involves healthcare?
Well, there are many organizations, groups, congressional committees, and agencies that are deeply involved with healthcare. There are many health maintenance organizations, or HMOs, out there. An HMO is a specific type of healthcare plan that sets out guidelines under which doctors can operate. On average, healthcare coverage through the use of an HMO costs less than comparable traditional health insurance, with a trade-off of limitations on the range of treatments available. The HSRA, or U.S. Department of Health and Human Resources, regulates Medicare and Medicaid through the CMS Centers of Medicare and Medicaid Services.
Medicare and Medicaid are two governmental programs that provide medical and health-related services to specific groups of people in the United States.
Medicaid is a means-tested health and medical services program for certain individuals and families with low incomes and few resources. Medicare is a federal health insurance program that pays for hospital and medical care for elderly and certain disabled Americans.
In the House there is a subcommittee within the Small Business Committee on Healthcare and Regulations. Republicans holding the majority.
Interest groups include American Medical Association, American Public Health Association, Families USA, and Health Insurance Association of America. They all share goals to influence the healthcare policy.
Healthcare is amazing.
It sure is.